It is the second Tuesday of the month, and so that means that we get to entertain GRMC and our regular feature, Your Healthcare Partner. And today, I'm so happy to have back in the studio, again, Dr. Justin Hale. He's a neurologist and a sleep specialist at Guam Regional Medical City. Good morning. How are you?
Good morning. Doing great.
I'm glad to have you here. I got to ask you, this is an obvious question. How well do you sleep?
I am very fortunate because I sleep really well. I sleep like 8 to 9 hours.
Is it because of your practice and you have like the inside secret on doing it, or is it just your body that allows you to shutter out anything that interferes?
I think I've always been a pretty good sleeper. And, my boys are kind of old enough now; they let me sleep. So.
Well, there's that. We are honoring today, or observing National Sleep Awareness Week. Right, and is it National Sleep Day on the 15th?
World Sleep Day, right?
World Sleep Day.
Worldwide event.
It just sounds so satisfying. Is there something psychological that happens when you talk about sleeping? Is there something like either you dread it or you salivate over the possibility?
I personally love talking about sleep. That's why I did my sleep fellowship, and some people, it puts them to sleep when you start talking about it. But for me, it energizes me. It gets me excited.
I'll tell you, I was just telling you that I had spent a couple weeks traveling, and mostly in California, where I hate to say it like this, but I slept in more weird places or more out of my zone places. Starting off with the airplane, and then in somebody's in guest room, and then in a hotel room, and then sharing a bed, with my sister, because that's how sisters do. Grown women laying in bed all day watching, television. And each time, the funny thing my sister said to me, because she went in and she invested in some incredible bedding and this pillow that is like, they call it a cooling pillow that memorizes your face or something crazy like that. And she said, I'm just so excited. I'm so excited to go to bed. And I thought, well, who gets excited about going to bed? She said, I love it. I love, being in bed. Yeah. But then I've also talked to people who have insomnia, and they say never spend all day in a place where you eventually need to fall asleep.
Right. So I think, we call that psychophysiologic insomnia. So this is I encounter some patients who have kind of this bad relationship with their bed. Yeah. It's a sort of place where they think about all these bad things that happen during the day, and they're fearful of going to the bed. Perhaps they're afraid of having nightmares. They're laying in bed saying, "Oh, I'm never gonna fall asleep, and I'm gonna feel horrible tomorrow," and it's just a bad situation. In fact, these people with psychophysiologic insomnia, if they maybe sleep in a hotel one night, sometimes they'll sleep great because they don't have that bad relationship with a hotel room. Right. So, so you do have to have a good relationship. I'm very fortunate because I have a very positive experience with sleeping, but not everybody has that. Right.
So. Well, particularly new parents. Can we discuss that? Because I think that's where the deprivation comes in first in your adult life if you have children. Right,
and it's in some parts of the world, parents can get extended time off in order to have a lot of time with their children, and they're going to be sleep deprived, but then they can nap the next day. Like when baby sleeps, mom can sleep. Right. But unfortunately, we kind of have a very 24/7 society, and you have to get back to work. You have to, so you're sleep deprived at night. Then you have to go to work all day. You come back, and you're sleep deprived the next night.
That almost sounds like a socio-political comment. Would you? You know what I mean? That in America, we probably don't offer the same amount of downtime after a baby.
Yes. Right. And I think and hopefully our awareness of the importance of sleep is increasing, and but we really do live in a 24/7 365 society, and a lot of my patients are doing shift work, which is really horrible. Shift work is considered to be, by the World Health Organization, has determined that sleep deprivation shift work is a probable carcinogen. So this was based on a big study of nurses that showed that there was an
Really?
elevated risk of cancer for those nurses who were working overnight.
And because they can't sleep. But I wake up at 3:45 in the morning, and I'm here until whenever I leave after the show. And there are people in the morning that when I'm stopping off for paper or coffee or oatmeal that have worked these shifts from mid 11 or 12, and they live in a whole nother world.
Yeah.
And that is there a segment of the U.S. population where these studies come from, right?
Right. And I've had to do that myself. I've done, in my medical training, I had to do the night shifts. And yeah, when you get off a night shift, it's hard to go home. The sun is coming up, that you're getting all these signals that it's daytime.
But are they morphing into a different sort of person now? Is that a segment of the population that is not the norm anymore, or maybe is the norm?
I think some people are just more can adapt to it better than others. There's something we call shift work sleep disorder, which is basically defines those people who just do horribly on night shifts. Yeah. Some people are fine with it and they do great, and it's never a problem. But essentially, when you're sleeping during the day, you're sleeping out of sync with your natural rhythm, because your sleep is on a clock, and every 24 hours your brain is ready to go to sleep, or should be, and that's signaled by a burst in the release of melatonin in your brain. Your melatonin is a natural hormone. You make it every night on a 24-hour cycle, and so if you're not really ready to go to sleep at that time, then you're kind of missing a train. And
that's interesting, right?
And everybody's melatonin release might be at a different time, and that time is shifted either earlier or later by the exposure to light.
So that's the crux of
that. Yeah, light is very
of it.
important. So when you're exposed to light, that's how your brain knows when it's time to sleep or time to wake up. That's what sets your clock.
We're guided by sunrise and sunset.
Absolutely. Just like every other animal, except cave-dwelling animals.
Yeah, where they can sleep all day. Okay, now there are other disorders that are harder to overcome. Sleep apnea, for example. Is that one of them?
Yes, sleep apnea is kind of most of what I see in my clinic.
What is that? Is that, I always notice if somebody's breathing weird or holding their breath or something.
It's extremely common. I see it all the time. Really? And
it's scary a little bit.
Exactly. Yeah. You see people sort of doing this shallow breathing or stopping breathing completely. These apneas, as we say, they last for 10 seconds, sometimes a minute and a half, even, where there's shallow breathing. And it's all about the numbers. So it's actually normal to do that a few times an hour. I do it 3 times an hour. I stop breathing 3 times an hour, and that's kind of normal. Less than 5 is normal. If you're stopping breathing more than 30 times an hour, so that's like once every 2 minutes. Yeah. Then that's severe sleep apnea. And we know that is a risk factor for bad things to happen down the road. It's kind of like having a diagnosis of hypertension or diabetes. It's a risk factor for heart attack, stroke, and other bad things. So if you're stopping breathing more than 30 times an hour, then you need to get it fixed. You need to be on a Cpap machine, most likely. And that kind of, the Cpap machine is a mask that you wear over your nose, and you're breathing with pressurized air.
So even if you hold your breath, it's pushing air through either way?
Exactly. It's stenting open the airways. So basically with sleep apnea, your upper airway, basically behind your tongue, is collapsing, and it's doing this repeatedly throughout the night. How does that happen? I mean, is it a person's natural makeup? Is it some
weight?
Some of it's genetics. A lot of it is weight. So it's kind of in a lot of situations you kind of consider it like diabetes. It is something that's, in the majority of cases, it is reversible. It's kind of a lifestyle disease. Right. Not to say that I have some very skinny patients with really bad sleep apnea, but in the majority of cases, it's weight related. So as you gain more weight, you don't just gain weight in your belly and your thighs. You also gain weight in the neck. You gain weight in the tongue. The tongue can become overweight and really
gain weight in the tongue.
Absolutely.
Who
yes.
knew?
Yeah. And it can really crowd the airway. The airway becomes sort of smaller, and So you're breathing through a straw as opposed to breathing through a more open airway. And so just a little that, naturally when we fall asleep, the airway relaxes, the muscles in the jaw and the tongue, they relax, and things kind of fall back. Gravity is kind of pulling things back, and so if you that airway will collapse, and then after 10 seconds, maybe a minute, your brain will wake you up. People don't remember waking up, but the brain kind of alerts you, and then you start breathing again.
Interesting. I have a friend who told me that she uses a sleep aid, and I'm not quite sure which one of them is, but she says, I take it, I go to sleep for straight 8 hours, I wake up refreshed, I could be at on the road running at 4 o'clock in the morning.
Yeah, well, there are prescribed sleep aids, they're over the counter. I'm not a big fan of using a lot of the over-counter sleep aids. Most of them are antihistamines. And those antihistamines can have, we're talking Tylenol PM, Benadryl, Unisom, some of these over-the-counters, and they will generally cause some hangover effect. And they can also dry your mouth out. They can cause you to not be urinating as well. And then you develop a tolerance to them very quickly. And then you have rebound insomnia if you ever try to stop them. So I'm not a big fan of those. Okay. In general, I find that treating sleep apnea and working on behaviors related to sleep, so avoiding caffeine after noon, going to bed at the same time every night, not getting too much light exposure before bed. These sort of behaviors are actually very effective at helping people sleep. There
is still that old school. I think Bob is one of them. Bob being a retired Navy chief. Maybe you could clap on your headphones for a second there,
sure.
Dr. Hale, if you don't mind. Dr. Justin Hale, a neurologist and sleep specialist from GRMC. Bob tells me that he's a consumer of coffee, and you pretty much have a coffee all day, right, Bob?
Right.
Yeah, from the morning you wake up and almost you can take a nap during the day.
From about 2:30 in the morning until 9, 10 o'clock at night.
Yeah. And you still sleep soundly.
Yeah, I sleep like a log.
Wow, is that interesting? The caffeine concept.
Right. So caffeine. Like my father-in-law, he actually gets up, will wake up in the middle of the night, and he goes and drinks some coffee, and then goes back to sleep. So, so coffee is the caffeine. So the longer you're awake, you're accumulating some chemical in your brain. You're getting more and more of what we call adenosine, and that adenosine is a signal to your brain to tell you that you're sleepy. So by 10 o'clock at night, you've got quite a bit of adenosine, and you sleep. You flush out the adenosine. Caffeine blocks that signal, so it tells you, no, you're not tired. You don't have very much adenosine in your brain. Go up, be awake longer. Okay, that's what caffeine is telling your brain. But some people, if you're kind of a chronic coffee drinker, if you're drinking a lot of it, then that effect kind of wears off. So it just becomes not as strong of a signal.
Doesn't cause you to, maybe you have overproducing adenosine or something like that. Is that possible? You've overproducing?
Well, it's not necessarily that you're overproducing it, but the effect of the caffeine wears off after a while. If you're kind of a chronic coffee drinker, and coffee's great. Don't get me wrong. There are a lot of studies showing its health benefits, and so I don't make a big deal about coffee. But sometimes I have people telling me that, hey, I can't sleep, I have insomnia, and then I find out that they're drinking pots of coffee, and I say, okay, well, we should probably work on that. But some people can drink coffee and sleep just fine. So
another sleeping aid that is not over the counter, nor is it prescribed, is the use of alcohol. Taking a shot of whiskey or something.
So alcohol will help you fall asleep quicker, but then it often wakes you up earlier, particularly in your REM sleep. It destabilizes REM sleep. So you might notice that after some alcohol that you will be waking up in the early morning hours. Yeah. So it's not a great sleep aid. Also, you get it. It's kind of similar to the Benadryl. It's similar to caffeine. You develop a tolerance to it after a while.
And then if you go back into a insomniac state, then you have no aid left.
Right.
if you're dependent on. Is there an actual clinic at GRMC, or is there the service?
Right. So we have, I do neurology. That's my primary specialty, but I also see a lot of sleep. I'm the only permanent sleep doctor on island. Dr. Slattery comes over to Guam Sleep Center, I believe, every few months. But I'm the only sleep doctor on island who's here permanently, and so I diagnose a lot of sleep apnea. We have home sleep testing available at Guam GRMC, and so you can basically take a device home with you, use it overnight, and in your own bed. You basically it's a little box that you wear on your chest, and you have 2 belts and a finger probe.
It's very
and
easy.
Yeah,
I've done it.
You've done it.
Yeah.
What about? I don't know. In the world of neurology or the specialization of sleep, nightmares.
Right.
Does that come into the science?
Yeah, nightmares. Unfortunately, we have a lot of PTSD on this island. There's a lot of military folks have been in Iraq, Afghanistan, Vietnam, and these guys, they come home and they're having nightmares, and there's a good chance that they're going to have nightmares for the rest of their life. Some of them are having multiple nightmares every night and waking up from them. So there was a big study in the VA that showed that treating sleep apnea can help with nightmares. People tend to sleep through the night more soundly when they're breathing better. Makes sense. And so they're maybe not bothered so much by the nightmares. But yeah, they can be a real problem. And the primary thing, I treat a lot of the guys from the VA and Naval Hospital with Cpap and
that's like the go-to. Is
right,
that
right. And fortunately, the U.S. military is very proactive about approving
the use of it.
The use of it, and they're kind of on board with treating sleep apnea to help these guys sleep better.
What's the course though of treatment? I mean, do you eventually come to a place that you don't need the extra oxygen coming through or the air being pushed through?
The majority of cases, people have to remain on the CPAP lifelong. I usually just, I've had a few patients who have been able to get off of CPAP. Mostly it's because of weight loss. It's really the only other way that I know of really reversing sleep apnea is weight loss. Now, if they already have a normal weight, I don't recommend that they lose weight. But yeah, some people have been able to lose the weight and get off the CPAP, and they're breathing better, they're not snoring.
So what do you do, when you have a bed partner that you notice in the middle of the night is holding their breath or snoring so loudly? What is the common reaction is to beat them over the head with a pillow, but that's not going to let anybody sleep for the rest of the night. What is the best for a supporting spouse to try to help her partner who's having a hard time?
Well, remember that with sleep apnea, you're stopping breathing a certain number of times per hour. And in the majority of cases, what I see a lot of times, people are stopping breathing 30, 60, 90, 100 times an hour.
My goodness.
And so you're not going to necessarily, shake them awake. 100 times per hour. That would be impractical. So really, the best thing is just to get them to a sleep doctor or to their primary care doctor.
Does it make a difference in the position that a person sleeps?
For some people, it's very positional. So usually in our sleep apneics who are more thin, they can have a very strong positional component to their sleep apnea. So they may only have sleep apnea on their back, because of gravity pulling the tongue backwards, the jaw back.
That makes sense. So sleeping on your stomach. Or on your side.
So for those people, and in fact, they make these pillows that keep you off of your back. And in general, people have less sleep apnea on their side. Most of the time, they have a little bit less. But I would say the majority of my patients, if they have sleep apnea on their back, they also have a significant amount on their side too. Yeah. And so really, it's CPAP. I'm sorry.
No, I mean that's the solution. Let it be the solution.
Yeah,
absolutely.
Unfortunately, that's where we are.
But if it's not that, if it's not sleep apnea and it isn't a sort of disorder, if it's psychological, as you point out, I think the moral of the story is don't play in your bed if you plan on sleeping in it later.
Right.
And bedding is always helpful, right? Getting like I just want to go to your house and just check your bed, just to find out what Dr. Justin Hale does in order to get an 8-hour.
It's actually nothing fancy. I mean, there was a study that was funded by the mattress industry, and they actually were very disappointed in the results, because the $200 mattress and the $5,000 mattress were basically the same. People slept kind of the same in terms of their percentage of REM and their percentage of deep sleep and sleep continuity. But the major decline when people were not sleeping well was when they compared the mattresses to sleeping on like a concrete floor.
Well,
That's when people slept really poorly.
Sure.
But the mattress doesn't.
the quality of
The quality of the
stuff,
mattress
yeah.
doesn't really matter that much. I
Yeah.
mean, there are bigger fish to fry, you might say.
Yeah. But I tell you what, the bedding, some foam thing that my sister put on top of her mattress was going to keep me in her bed pretty much all day. But it was absolutely great.
Yeah, I think the mattress
Yeah.
can be, and the pillow can be very important for like back pain and
Yeah.
neck pain,
Yeah.
those sort of things.
Well, I tell you, this is such an interesting conversation. I'm so glad we are celebrating a World Sleep Day on March 15th. What would you advise people to do on to mark the occasion? Try not to sleep at work, but
well, if you're sleep deprived, you're not going to be able to just take one day and catch up on it. So it really has to be a lifestyle, day in, day out, going to bed at the same time every night, and making sure you're getting good quality sleep every night.
Dr. Justin Hale, it's been a pleasure. Thank you so much. I appreciate
Yes,
that.
thank
That's
you.
your healthcare partner from our friends at the Guam Regional Medical City.